All right, everyone, we're going to get started this morning. Welcome and thank you for joining us for another webinar Wednesday here at Messer Financial Group. Just before we get started, as a reminder, what we'll try to do is go through Brian's presentation this morning, and we'll take any questions and try to provide as many answers as we can at the end. Also, as a reminder, for those of you that were kind enough to enroll for the webinar and also attend, you'll get an email from us with the slide presentation and some additional facts and things to think about as you go forward with your day and go out into the field. If you need to get contracted with Emeritus through Messer Financial Group, please make sure that you use your Sure LC profile with us. If you have questions about how to do that, please call us at 866-568-9649 and ask to speak to one of the marketing directors or someone in producer support. They'll help walk you through either getting that account set up or where you need to go and log in for that. As a reminder, guys, what we're going to talk about today is something that will help you to better adhere yourself to your existing clients. We always talk about the fact that one sale doesn't make somebody your client. So the more product lines you have with them, typically between 3 to 5, then you really do become their agent and their health or insurance advocate. So that's what we're hoping to help provide to you today, is just another product that really does carry some value for you as you go into the home, whether it's the under 65 or the over 65. And there's so many statistics out there today, whether that's through various medical associations, that talk about how important it is to have good health inside your mouth. So whether that's tied to early detection of mouth cancers or oral cancers, some of the other things that it's tied to are liver and heart disease, obesity, diabetes, and there's some other things that can be found when they do the x-rays and so forth that can really help improve the quality of life of your client. And we joke about it a lot, especially on the senior products, whether they have one tooth or a full set, but it really does make a difference, and especially with young people today, the confidence that a good, clean, beautiful smile can have for them as they go forth to create their life in the workplace. So with that, again, if you have questions, please hold those to the end, and we'll try to get to those. Brian and I hopefully will have everything that you may have a need to know today. But I'm going to turn it over to my good friend Brian Durham, and let's have a great webinar, guys. And again, thank you for attending. Brian, take it away.
Thanks, Jeff, and thank you everyone for joining. I didn't realize that in addition to Jeff being, doing everything that he does in the Medicare arena at Messer, that he's like a part-time comedian. Between the one tooth to full teeth, and then between the other comment of balmy, warm Minnesota as I sit here and stare at about 3 feet high snowbanks. If you're not laughing, you're dying. So that's pretty funny stuff. I appreciate it, Jeff. And just to set the record straight, whether one tooth or a full set of teeth, we take them all. We don't discriminate. Well, thank you again for everyone for joining here this morning. I'm Brian Durham with Emeritus. I'm really excited to speak with the Messer agents because we've got a really good offering with the Emeritus Dental and Vision Plan. So if you haven't taken a look at it before, I'm excited for the opportunity to talk about, why you need to be looking at dental for your clients. It's one of the most overlooked products, in my opinion, but yet out of the ancillary world, one of the products that has some of the highest need. The great thing about dental is when you say dental, they know what you're talking about. There's a lot of ancillary plans out there that make a ton of sense for the clients with the right needs, but many of them outside of dental and vision, it's a sale. And what I mean by that is you've got to educate them. You've got to make them understand why this is a need. But if you just say dental, they know what you're talking about. So with that, let's jump into it here. I've got some slides prepared. They're going to talk about the product. I've also got some slides prepared to talk about, when I sold Medicare, how I would talk about dental. We'll also kind of couple in there for those of you that are doing under 65 business, because we do both under 65 and over 65. And then from there, I want to kind of show you how simple the process is to get appointed and to do enrollment. Jeff told me, Brian, be brief when it comes to background on the carrier, so this is going to be my attempt to do so. Here's what you need to know about Emeritus and how we're different. We're a mutual company from Nebraska, but we're dental focused. Out of our $2.whatever billion of revenue, the slight majority of that business is dental, which is pretty unique. So we're a dental company through and through. The majority of our business is group dental. So we're one of the main top 4 or 5 players on the group side. And then we're actually the leader on the individual side. So between those two, dental is what we do. So if you're looking for a company to offer a really good quality dental plan and a really quality dental service, we like to think anyways that we've got it down. Another thing that's unique about Emeritus is we've got all 50 states. So regardless of where you're located, whether you're in SEC country or elsewhere, we've got all 50 states. The states that are highlighted there, we have those states approved, but they're just going to be slightly different from what I'm about to show you. So once again, there's a little bit of a state variance there. So here's our plan. It's called Advantage Plus. I'll walk through it from kind of, from left to right here. Preventative services are 2 cleans and exams per year. Bite wing x-rays are covered. That's all covered at 100% day one. If I jump to the right side of the screen for just a moment, the deductible is only applicable to basic and major. It's not applicable to preventative. So this is actually, most agents, when they look at dental, they look at maximums and they look at what is covered on major. And I understand why, but in reality, preventative should be the category that you drill in the most on. And the reason why is because preventative is the most claims. Major is the most expensive claims for the client and for the insurance company, but they're infrequent, right? Knock on wood, you don't have a crown or a root canal every single 6 months, but you are going to have exams and cleanings every 6 months. And so most of the money that your client is going to spend will be on preventative care. And what we're starting to notice is there's more and more carriers that are dialing back the preventative care because they want to try to keep that premium as low as possible. With us, we're taking the opposite approach. The reason why is because your clients, when they were on group dental at one point in their lives before they retired, group dental almost across the board covers preventative at 100%. And so what we try to do with our plans, what I tried to do when I was designing this, was to emulate group dental as much as possible, because I want to try to create a product that's as simple as possible for you to sell. And so if the product works like the client assumes it works, you can take what is typically a 10-minute sale and knock it down to 2.5 minutes, because you don't have to run through all these gotchas. And the biggest gotcha that most clients are starting to notice is preventative care is not covered at 100%. We still do. From there, basic and major services, we're kind of known as the day one company, so we don't have waiting periods, which is really nice. You're going to get 50% coverage right away on basic, and that's simple things like simple extractions and fillings. And then you're going to get 15% coverage right away on major services. That's all your big stuff, like root canals, dentures, implants are covered. That's nice. More and more seniors are getting implants done. Or for those of you on the under 65 side, if you get someone that loses a tooth, whether naturally or through an accident, they got a long life still to live. They probably don't want to think about doing some sort of partial. And so an implant, cosmetically is a lot nicer. The annual maximum with this plan, you have a choice. You can buy the $1,000 version or the $2,000 version. Lots of times to double the benefit, it's only about, $6, $7, $8 more a month. And then last but not least, for those of you on the under 65 side, we've got an Ortho Benefit, which is really nice. The Ortho Benefits for children, it's similar to the major services in the fact that it starts at 15% right away, and it's a $1,000 benefit. Now with the basic, major, and ortho, those benefits increase on a calendar year. So it doesn't matter when you sell them the policy. You can sell to them in January, you can sell to them in December. What we do is we take all the policies that are effective in a given year, and we increase the co-insurance come January 1st of the next year. So you could literally sell to them at the end of the year and just have them wait a couple of days to get to January 1st, and then those benefits will go up. So once they've held it through the calendar year, they'll have 100% on preventative, they'll have 80% on basic, and they'll have 50% on major, and they'll have 50% on ortho. It's pretty slick. Then at that point, they've got just as good as what a group plan would be able to offer them. One question I get a lot on the ortho is Invisalign or the Smile Direct Club. That's getting more and more popular. We do cover essentially any ortho procedure, and so the Invisalign procedures are covered. And that's something to kind of keep your eyes on. It's something I keep my eyes on anyways. but that's increasingly popular. It's at a very competitive price point. Most of the Invisaligns that we see from a price point are somewhere between $1,750 to $2,000. And so, you can get someone in braces for $2,000. You don't have to have, the wires and, the binders like what I did when I was a kid. And with our plan, we'll cover half of it, right? We'll cover up to about $1,000. And so that's a really nice feature for if you've got families you're talking to and they start joking around with braces and how they need to start saving up. Tell them like, hey, I've got a dental plan to pay $1,000, and you can go to Smile Direct Club or like an Invisalign, and lots of my clients are only about $750 to $1,000 out of pocket. That's a far cry from $3,000 to $4,000 that they may anticipate to be paying. So, in summary, with this plan, there's one plan, but there's a couple options. One option is the maximum, 1,000 or 2,000. The other option is the network. You can do network or non-network with us. Our network is by far the best network you're going to find in the individual dental space. I'll talk more about that in a moment. But if your client is going to go to a dentist that's not in the network, you can buy one of those plans as a non-network plan, or you could just call that an indemnity plan if you would like. And so really, you've got the best of both worlds. Now, we've got about 65 to 70% of the nation's dentists in our network. And so this isn't a small little HMO network by any stretch of the imagination. So the majority of our sales and the majority of our claims are the network. So that's what I would kind of focus on. But if you've got seniors that are very particular on which dentist they go to, and unfortunately that dentist isn't in their network underneath that assumption, you could sell them a plan that does cost more. Those non-network plans cost more, but you could sell them a plan that would allow them to still go to any dentist. On a nationwide scale, we're slowly but surely getting close to 500,000 access points with an average discount of 32%. If you geek out on networks like I do, and I'd recommend that you don't, I'll give you the summary. Here's how networks work. They're a teeter-totter. Either you get very high access points or you get very high discounts, and it's virtually impossible to get both. So by way of example, Delta Dental does a very good job of creating the largest network that's out there. They've got more dentists than anybody else with their group plans. But the average discount on that really big premier network, as they call it, is literally zero. So they're just trying to get everybody and their mother in the network. The opposite approach is create a very skinny network, almost like an HMO, and maximize the discount. Maybe get that discount at 40%, 50%, right? What we try to do is we try to do our best to kind of maximize both. So we, like Delta, want to get as many dentists in our network as possible, but we also realize that for the clients, there's really not a value for the network unless there's a good discount related to the network. And so because of our group operations, as we get big groups in various cities and towns, that gives us the leverage to contract these dentists at a legitimate true discount, way above and beyond what they would ever accept for a cash payment or many of the other networks. And so that's going to be a real benefit of partnering with a company like Emeritus, who's really big on the group side, because if we didn't have my counterparts on the group side and we're just running off of my individual products here, there's just not nearly enough scale in the individual market to build a dental network. You need to have at least about $1 billion of dental to have leverage enough to build out a quality network. And that's just virtually impossible, given that the total individual dental market is about $2 billion, right? And so that's a big benefit of working with a dental-focused company like Emeritus. Let me give you a specific example of how good insurance coupled with the quality network really helps. This is a crown in balmy, warm Minnesota. A cash price, if you don't have insurance, which is the UNC rate, costs $1,227 for a crown. With just our network discount, we can get that price down to $772. Then after you layer in the 15% insurance that they would be able to get tomorrow, that price goes down to $656, which transpires to a 47% savings for the client. And that's day one, guys. your client could literally call you up and say, Mr. Agent, I know I need to get a crown. It's a pre-existing condition, and I'd like to get it by tomorrow. Can we make that happen? And with any other health product, you've got to laugh them out of the room. But with dental, you can literally make that happen. We don't have pre-existing conditions. We'll cover the crown as long as the work's not been started, and you can make this policy to be effective tomorrow. And they can go tomorrow, and we'll cover it. Now, let's assume that they hold the policy till January 1st. The benefits have gone up on January 1st. Then in that instance, the client's out of pocket is only $386. That's a 69% savings. And if you note the savings percentage of 47 and 69, if we just did indemnity plans, those numbers would be 15% and 50%, right? And so when you can couple the network with really good insurance, that's ultimately why we give more value than anybody else in the individual dental market. Let's talk not about dental. Let's talk about what are some good ways to sell it. I'm going to kind of focus on Medicare specifically here for a moment, but for those of you on the under 65 side, much of this will translate as well. So I've got 3 different ideas for you to consider when you're trying to incorporate dental into Medicare. I used to sell Medicare for a little while myself. Admittedly, out of all of these ways I'm about to show you, here's the real trick. The real trick is you just need to talk about it. Whatever way that works well for you to talk about it is likely going to be fine, but here's 3 different ways to kind of, draw your memory on things to consider. Number 1, use a generic scope of appointment form that already has dental on it. If you're using scopes in most of your appointments because you intend to talk about, CMS regulated product like MAPD or something else, maybe a PDP plan, right? Use an SOA that includes dental, because in that way, 1, from a compliance standpoint, that's how you're technically supposed to do it. But 2, if they want to talk about dental, or if you want to bring up dental, which you should be doing in every single appointment, you now have the ability to do so. And the SOA is kind of almost a nice excuse to bring up dental, because you can show them the scope of appointment form. They've got to check the boxes and sign at the bottom, obviously. And you can say, all right, check the box. We're going to check the box here on the MAPD. We're going to check the box on the Part D. But we also need to check the box on dental and vision, because that's the big thing that's not covered. I want to talk to you about that. If you just do that alone, even if you didn't bring up dental after the fact, half your clients are probably going to be telling you before you run out of the house or get off the phone of like, oh, wait, we're supposed to talk about dental and vision. So that's one idea. Another one is to talk about it in some way, shape, or form that is woven into your Medicare conversations. When I sold Medicare, I would reference lots of times the Medicare and You guidebook, and I would have just a handful of pages that I would quickly point out to them to help explain how Medicare is structured and how it would work. One of the pages that I would always stop on used to be page 59. It's now in the new book, it's page 49. And that's the page that talks about what's not covered. And guess what the number 1 thing is on that list? Dental. The number 2 thing is vision. And so those are the biggest expenses that the Medicare and You guidebook is referencing that is not going to be covered, and just kind of hits home on why you need to be talking about it. Last but not least, this is something that my Medicare agents I find are very guilty of, but if you talk to agents that are more focused on the health side, very less so. And what I mean by that is agents that sell health, we've noticed, sell dental better. And one theory why we think, and when I say they sell it better, what I mean is my ad hoc studies and asking questions of how successful they are in cross-selling it, what their cross-sell rates seem to be higher on the health side. It's by no means a scientific study, but just doing this long enough, that's what I've gathered. I think one reason why is because health has been changed so much, and there's deductibles regardless, right? And so there's a much more of a conversation on the ACA side or the short-term medical side of what it does and what it doesn't cover. On the Medicare side, it's been such a stable market for so long. It's such a good insurance. I hear agents, and I was guilty of this myself, of just like, oh gosh, you know what? You're turning 65, bless your heart, because this is gonna be the best insurance you're ever gonna have. Medicare, this is what you've been waiting for. The clients know that too. We're gonna get you set up with the Plan F or the Plan G. Everything is gonna be covered. or we can look at this local MAPD plan. As long as you stick in this network, it's a zero premium, whatever it may be, but if you get so fixated on how great that insurance is, and it's the best thing ever, it's the Cadillac of all Cadillacs, that may be helpful in terms of selling that plan, but it's definitely not helpful in trying to help them understand what may not be covered. And so take a little bit more of a good news, bad news approach. And if you sell health insurance, you know what I'm talking about, because health insurance by no means, Obamacare by no means is perfect in terms of the plans that they offer. They've got fairly high deductibles. There's decent premiums related to. And so if you take more of a neutral stance of, hey, Medicare is a very good insurance, don't get me wrong, but it's also not perfect. There's also things that it's going to leave you exposed on, like dental, like vision, like hospital confinement. So let's talk about a hospital indemnity plan, maybe LTC. There's a whole long list of things. And there's many good reasons why you should talk about all of those. But selfishly, as a dental and vision guy, what I'm here to say is if you're not talking about any of those, talk with Jeff, because him and his team will help you get more products in the door, as he said in his intro. So then that way you really got a customer for life. But if you're not talking about any of them, the easiest spot for you to start is dental and vision. Because once again, if you say the word dental insurance, they know what you're talking about at the very least. You've got a basic conversation you can have that's 2-3 minutes tops. If you say the words, hospital indemnity or specified disease plans like cancer insurance, they don't know exactly what you're talking about. With all that said, let's jump into vision, and then we'll talk a little. Vision will be relatively quickly. We'll talk about process and how you get appointed and what that enrollment process looks like, and then we'll wrap up for questions. So vision, we have vision in 47 states. 3 states we don't have is Maryland, New York, and Washington. Vision, what's great about vision is there's really 2 big networks that are out there, IMED and VSP, and we have them both. And when you have those 2 side by side, you virtually have 100% of the eye doctors that are out there. We're the only dental carrier that has both big vision networks available side by side. Once again, the reason why, I'm going to sound like a broken record, I apologize up front, but the reason why is because we've got enough scale with both of them due to our group operations. Otherwise, they don't like being put side by side. So here's how our IMED plan works. IMED, from a network standpoint, has the big retailers like LensCrafters, Pearl Vision, Target. The IMED plan is a little bit cheaper than the VSP plan. The monthly rate's $10.67. The eye exams are covered once per year. The glasses are covered every 2 years. But just like the dental, it's all covered right away. That first pair of glasses are covered right away. Day 1 benefits. The copay on the eye exam is $25. The frame allowance is $130. And then the copay for lenses is $25, regardless if you're getting a single or a bifocal. So if you think of a typical visit to a retailer, you first go get your eye exam. And your cash price, give or take, is usually about $75 to $100 on an eye exam. And then from there, with your eyes all dilated, you can't really see much. They tell you to go pick out a set of frames. When you do that, you can buy any set of frames that you want at that store. This insurance will cover the first $130 of it. Anything above and beyond that is going to be a client's responsibility, but they will get a network discount, which averages 20% on those frames. And then last but not least, you're going to get lenses. The doctor's going to tell you whether you need a single or a bifocal or a trifocal or, God forbid, a lenticular lens. Never actually heard of someone getting a lenticular lens, but it is covered. And regardless of which one you need, there's just a flat copay of $25. And then from there, the retail associate's going to try to talk to you about all the various lens enhancements that exist out there. And we cover almost all of those lens enhancements. It's not on the slide here, but if you look at one of our brochures, if you go to our website and take a look at our online enrollment tool, there's specified copays for each one. It's like the UV tint, I think, is $14, or progressive lens. So there's a list of copays that correlate with each one of those lens enhancements. The out-of-network, I wouldn't really worry about too much, simply because half of the eye doctors are IMED, the other half are VSP. You literally have like a 99% coverage between the two. VSP. VSP has the vast majority of the independent eye doctors. And so if they're going to go to Dr. Johnson on Main Street, it's a high likelihood that he's going to be a part of VSP. VSP also has Costco. VSP also has about half of the Walmarts. There's about half Walmarts that are in VSP. The other half aren't a part of anyone's network. So they're just going to be out of network with any of those plans. The VSP is $16.34 a month. But the benefits are also a little bit richer. So a few different ways that they're richer are the glasses can be purchased every single year, or IMED by way of comparisons every 2 years. And then also your copays and allowances are better. You have a $10 copay in the eye exam, you have a $150 frame allowance, and then you have a $20 copay in the lenses. So $30 in copays, $150 allowance, $50 in copays, $130 allowance. Okay. If we do a similar example where they're going in to get an eye exam with IMED, and let's say that they're getting contacts. Eye exam is $145, and then they get the contact lenses and they get the contact fit and follow up. If they paid cash, it's $515. With the IMED plan, their out-of-pocket expenses are $175. Even if you factor in the annual premium that you would pay for that plan, which is $128, they still come out $212 ahead. And now let's assume someone's going to buy glasses with the VSP plan, just kind of switch up the examples. They get the eye exam, they get the lenses. In this instance, they buy the UV coating and the scratch coating, and then they get the frames of $191. That's $470 for out-of-pocket expenses. With the insurance, it's only $80. Even if you factor in the $196 annual premium, they're still saving $194. So vision is very simple, guys. They're money ahead as long as they use it. So if they're wearing glasses, tell them, hey, with this dental plan, you can also get a vision plan. It's as simple as that. What we see at the carrier level is we see about a 50% cross-sell rate. So what that means is for every dental plan that comes in, roughly half of the plans also include vision. So let's talk about, getting started. If you want to get started with us, as Jeff mentioned, go to your SureLC account with Messer, and you can get appointed with us. That process is hopefully relatively painless for you. The turnaround time is about 48 hours on our end. Once you get appointed, you're going to receive your own unique hyperlink. I used to spend a lot of time around this link when we first launched it 7 years ago because it was a big novel idea, and many agents are still predominantly doing paper apps. And now as more and more carriers are going online, it's kind of less of a novel idea, and more agents are much more comfortable using these sort of links. But this is how we process all of our applications. It's super simple and quickle. It's super easy and quick. What's cool about it is because we're not a CMS regulated product, we're just dental and vision. We can really streamline that enrollment process versus what you're probably used to with some of the other carriers. So you can literally do an enrollment with us in 60 seconds. There's no wet signature. This is the home page of the enrollment tool that you see here. You're going to put in the client's zip code. It's going to ask whether you want to see dental or vision. It's going to ask, who's going to be covered, and then the coverage start date. We do any day effective dates, the 1st through the 28th of any given month. All the plans come up. You're going to pick the plan. All the details of the plans that I showed you in the PowerPoint slides are going to be in that hyperlink. So really, everything with Emeritus is going to live and breathe with this hyperlink. So to get your hyperlink, you need to get appointed. So get appointed, get on that SureLC website, get everything submitted here, and then you'll get that hyperlink. From there, here's the beautiful thing. From there, we have everything automated. And so this is the moment where, carriers have a tendency to talk about how great their service is. We, of course, strive for great service, but what we do that's pretty unique is beyond kind of great service of answering a telephone, we automate the entire process. And so what that allows us to do is for the 600-700 apps that we sell in any given morning, we don't touch one of those. And so as it pertains to kind of the process related after the fact of, the confirmation emails, the fulfillment, all that's automated. So this is a sample email that you're going to receive as a broker of record the second you hit submit. Just like when you buy something on Amazon, you're going to get a confirmation email. Better yet, your client is also going to get a similar confirmation email. And if they want to utilize those benefits right away, just ask them to print off that confirmation email in lieu of ID cards. Otherwise, from there's a nightly batch into our admin system. So if they call up the next day and they're checking in on that policy for whatever reason. I don't know why they do that, but at least when I sold Medicare, they would do that. I'd write them the app. 1 week later, they'd call up Blue Cross. They'd say, oh, hey, I should be having Medicare here. Well, I just submitted the app 2 days ago. It's still processing. And what do they tell the client? Ma'am, you're not in the system. You don't have it. Now they're freaking out. Now they're calling me back, right? With us, nightly batch, automated. So they call the very next morning. You can sell to them at 10 p.m. at night. They can call us at 7 a.m. We'll have it in the system. From there, there's an automatic feed to our printer for all of our fulfillment. So ID cards go out automatically. So then that way I don't have Jeff hounding me saying, Brian, they sold these policies and the ID cards didn't go out. It's automatic. It's not, unless the whole system breaks, we don't miss, onesies or twosies. And the way that you do that is kind of through technology, love it or hate it. But that way we don't have, human error, right? If your ID card is misspelled, it's because when you put the information of your client into the enrollment tool, it was misspelled. So that really streamlines this whole dental process, and that's the reason why when I talk with agents who like selling emeritus, they say, Brian, your products are really good, your network's great. But what I like most about it is just, I can sell it and I can be done with it. I don't have to worry about it, because if I sell a bunch of these dental plans and they're taking for a bunch of time, this isn't a very expensive product. I make good money off of it, and Jeff can tell you about the good money that you have an opportunity to make, but I don't make as much on dental as what I make on Medicare, right? So I don't want to be wasting a lot of time with it. And furthermore, my clients aren't happy with it. If they're having service issues, now I'm kind of, I'm hurting that relationship. Now maybe they're going to leave me on the Medicare side. And so the agents like emeritus because they're just like, hey, Brian, I can sell you. I can just kind of set it and forget it, just like the cooking shows, right? Because that entire process is streamlined. I get hopefully minimal calls because, we're just kind of getting it right the first time. So that's what I have. Hopefully that was helpful. For those of you that maybe want to check out the enrollment tool and see what rates look like in your specific area and what those plans look like, you can go to our website, which is star.emeritus.com, and you can kind of go on there yourself and kind of check things out and see if you like it. But once you get appointed, once again, you'll get your own unique link that has your information automatically populated in that. So with that, Jeff, I'll turn it back over to you for any questions we may have.
Yeah, Brian, I think just as a quick review, can you talk again about the calendar year and how that works with you guys? I think last year you joined us in the fall, and we tried to explain to people what a great opportunity or value it would be to enroll somebody before the end of the year on your plan. So if you would, just kind of go back over that so these guys understand that for us.
Yeah, sure. So actually, I'm going to go to that slide too, just to kind of help illustrate the point. So when you buy the plan, you get 50% day one. And you don't have to actually hold that for 12 months. It's just purely based upon the calendar year. So if you sell it to them here in the month of March, they don't have to wait till March. They just have to wait till January 1st. What's key about it is the effective date. It doesn't matter the date that you issue, or it doesn't matter the date that you sold the policy. It matters what day you make the policy effective. And so once we get back around AEP, kind of the trick per se is to not only sell it during AEP, but ensure that you give them an effective date still sometime in that given year, because then come January 1st, all those policies will get bumped up to these next levels of 80% basic, 50% major, and 50% in ortho.
Beautiful. So let's just make that clear, guys. So whether you're working on the over 65 market or the under 65 enrollment period, just think about that. You go into the home, you're sitting there with the client, and you help them to make sure that they've got a December 1 effective date or anytime before the end of the year. As soon as the calendar year flips over, they're into their second year of coverage. Correct, Brian?
That's correct. Yeah. And furthermore, to build upon that, you can let them know, hey, this plan's really good because it has some day one benefits, and most plans have waiting periods. But then like the cherry on top is to get to that next level of coverage, you don't even have to wait the full 12 months. We're in March, you only got to wait 9 months. You're in June, you only got to wait 6 months. And you're in December, you only got to wait a couple days. So it's pretty nice. You're not going to find stronger benefits than that.
Beautiful. As far as where we would find out more information, this slide's great. Can you tell them a little bit about where they go once they are appointed, where they could get to some of the granular information that you and I discussed prior to that?
Yep. So once they're appointed, they're going to get that enrollment link, and that's going to be where they go for processing all of their enrollments for quotes and enrolls. On that same page, there is a login in the top right, and that's where you can access your book of business. And then also within that, there's an agent portal section, which is where they would download brochures if they wanted to download brochures.
Beautiful. And we talked too as well that the marketing and brochures, the materials that are available, they can take those to their local print shop once they download them, and they can be personalized, correct, to reflect their name and telephone number and so forth.
That's correct. Yep. As well as we've got, not personalized, but just kind of our stock brochures and sales kits. We've also got these trifold brochures that just give a high level of detail on the plans, which some agents like because it's a little bit smaller. We have all those in mass quantities. And so if you've got interest in getting, maybe a couple dozen of those, feel free to contact Messer. We send those quantities to them, and as they run low, we'll kind of replenish Messer so that way they can send them out to you guys.
Great. Brian, in the event that I found a provider that maybe wasn't in the network, how would I go about maybe helping them to become part of the Meritas family? What would we do in that case?
Yeah, good question. So there's a nominate provider section when you look up our providers. So if you just Google like Emeritus providers, our provider page will come up. Also, there's links to it whenever you're in our enrollment process. And so there's a nominate provider section. Just put in the provider's information. Lots of times you're going to be putting in like the office manager's contact info. If you have it, that's the most ideal because they're usually the ones that deal with the contracting. We've got a whole provider recruitment team of like 20 people in a call center that, their sole job is to recruit these providers. And so them receiving a referral like that is like gold to them compared to cold calling on these providers. And so, any of that sort of stuff, they love to have. They can usually get to the provider and give them a basic outline of what the fee schedules would look like within just a couple days. But there is a credentialing process that providers have to go through just to ensure that there's various standards that are met. And in my mind, anyways, I don't know the details to probably fully appreciate them. But in my mind, it always seems like it's a little bit of a check the box. But that does add a little bit of length to that process. That usually means all in, it's about a 2 to 3 week effort. But once again, the big piece of it is just whether they'll kind of accept, those discounts that we're looking for them to accept.
Okay. And guys, if that seems a little confusing to you, don't worry about it. If you're in a particular area where there's a large dental provider there, maybe they have multiple offices in a county, and you want us to help you do that, just reach out to one of the marketing directors here. We'll reach out to Brian and Emeritus, and we'll help get that provider process started for you. Brian, a lot of our agents, they are truly independent, and they're opportunistic in everything that they see. If I dabble in group a little bit, what can I do in terms of group enrollments with Emeritus? How does that work for me?
Yeah, so we can take that in a couple different approaches. The first approach is if you've got what I would label micro groups that are 2 to 4 lives, 2 to 5 lives, something like that. You could just write them these individual policies. I mean, these are pretty competitive individual policies, even relatively group. And lots of those micro groups are going to get waiting periods if they're on conventional group plans. We can't do list bill with these individuals, so it's usually going to be a situation where the employees are going to be paying. But with that said, what you could do is when it comes to the payment section, if you're going to process 2 or 3 enrollments and the employer wants to pay, you could just simply put in that employer's checking account or credit card number. So it's not perfect and ideal, but it's definitely an option that many agents would do for those micro groups. If you've got groups that are a little bit more established or want more true blue group coverage, we do have a small group product that's from 2 to 99 lives that's available with Messer called Gemstar. It's what we call a brochure rated product, meaning there's 2 different plans, love them or hate them. There's kind of 2 basic plans that are available, $1,000 benefit and a $1,500 benefit. That's more of a traditional group product that we can get you set up with.
Beautiful, beautiful. And if you would, just go back over for us the difference between the network and the non-network plans as we get ready to close out here today, just so that everybody has a more familiar understanding of that. I think familiarity breeds confidence, and confidence is what gets that sale taken care of most times anyway.
Well said. I agree. So network and non-network. We offer that Advantage Plus plan is available as a network plan, and it's also the exact same plans available as a non-network plan. The network plan is cheaper. The non-network plan is more expensive. Why? Because the claims are more expensive on the non-network plans. We can't get that discount, right? So you've got a solution for the client either way, whether they're going in network or out of network, just depends on the product. The majority of our enrollments are the network plan because it's cheaper and because the majority of the dentists are in our network anyways. And so very simply stated, how I would approach it is I wouldn't describe the differences between a network and a non-network. I would just simply start by looking up the network and say, who's your dentist? Because I'm going to be able to get you a cheaper price if your dentist so happens to be a part of Emeritus' network. And they'll tell you one or two things. They'll say, great, it's Dr. Johnson. You better hope he's in my network. Or they'll say, oh, well, if I can get a cheaper price, my dentist retired 4 years ago, and I don't like the new guy anyways, and so as long as there's someone close by, I'm good. And so then either you look up Dr. Johnson, you cross your fingers that he's in network, and if he is, sell him a network plan. If he's not, sell him a non-network plan. Or you just found out that your client's indifferent, and then ultimately you can just do a zip code search and say, okay, here you go. I can have the email to print you off this list, and here's the 200 closest providers. But very simply stated, if they're in network, sell them the network plan. If they're going to go out of network, sell them the non-network plan.
Great. And Brian, in your experience, I know you've got some people that have been very successful in selling dental. Can you just pick out a couple of the objections that they normally get and how they would overcome those? Maybe the cost per month versus, oh, I'll just save the money up myself, something along those lines. What are some of the ways that you've heard the successful guys out there that have really tonned it with dental products? How have they overcome some of those objections?
Yeah, so I'll back up and say those that are successful with dental are those that bring it up every single time. And it's kind of like learning anything new. The first couple of times you do it, it might be slightly uncomfortable, but then thereafter, it just becomes part of your normal pitch. And so I talk to agents that sell a boatload of our dental, or in agencies that sell millions of our dental in terms of premium anyways. And they say, I'm like, I try to ask them those questions, like, what do you do to be so successful? They're like, I don't know, Brian. Like, we just bring it up. There's really nothing to it. This isn't rocket science. I don't get why everyone's not killing it with dental. And so it's really just about a matter of bringing it up more than it is overcoming any objection or having any sort of kind of fancy spiel about it. But what are some of the objections and how do you overcome it? To answer your question more directly, Jeff, I think in the Medicare arena, and this also is true for under 65, there's a little bit of a natural objection that comes into play when you talk about the fact that there's a zero premium MAPD plan, but my dental's still $35, right? Or to tie that to the under 65 folks, you're telling me I qualify for a subsidy with this Obamacare plan and $0, but I still need to pay $35 for the dental. Like that, the health should be more expensive than the dental, and why is the dental not included? So I think there's a little bit of a premium objection in those instances when you're selling a $0 health plan or close to. In those instances, I think the best way to combat that is to talk about preventative care. Hey, preventative care. I recently looked up an example, and I was in Chicago last week, so I looked it up. In Chicago, and Jeff, I can get you specific numbers if there's an area you want me to look up. But in Chicago, an individual pays $500 a year for preventative care, assuming they go twice per year. So for a couple, that's $1,000. They're going to pay $1,000, almost $1,000 a year in Chicago for preventative care if they're going to pay cash. But with our insurance plan, they literally pay nothing for preventative care. There's no deductible. There's no co-insurance. They pay nothing. So you can pay $1,000 in cash, or you can pay nothing. So let me look up how much this dental plan is, and as long as it's less than $83 a month, wouldn't you agree that you're just better off to buy the dental plan? And the clients may say, well, I don't understand why, if I'm going to pay $1,000, why would the dental plan be less? How, the company, this company is a for-profit company, right? Well, side note, no, we're a mutual company, so any excess profits go back to our clients. So we're very similar to a nonprofit. But the reason why is because of scale. The reason why is because of network. The reason why is because we can get the dentist to begrudgingly take a lower fee than what they would otherwise like to give out to the others. Those are the reasons why. So I think if price is ever of issue, I think the best way to combat it, to answer your question, Jeff, is to talk about the preventative costs that they're going to incur anyways. And if you want specific numbers of your specific area, a great resource that I'd write down is a website called fairhealthconsumer.org. Once again, FAIR, which is FAIR, healthconsumer.org. And that's good for not only dental, but also medical expenses. And what it allows you to do is to type in any specific zip code and then specify what procedures you want to see. And it will tell you the going rate of cleanings, crowns, root canals, whatever it may be. So that was a real long-winded answer. I apologize, Jeff, but hopefully that was helpful.
No, I think that's perfect, because I think in a lot of cases that is what we try to overcome. And one of the things I've heard people say, well, that's great. You may have the discipline to set that money aside, but what happens if your hot water heater goes out? Where's the first place that reserve of money is going to come from? It's going to come from that money you set aside, where it's far easier for this person to budget that lowly monthly premium and know that any dental concerns would be very well taken care of with you guys. So I think that's great. And I'll make sure that I get that website from Brian and put that into the email that goes out to the attendees today, so that they can look that up themselves and kind of have that in their back pocket if they do run across that objection. Guys, as we close out here today, again, just a very simple reminder to you that dental and vision sales can tie into so many products that you have with you, whether that's over or under 65, and can lead to some of those other ancillaries. Throughout the Southeast, we tend to enjoy foods that taste good, which usually means there's a lot of sugar in there. So tooth and oral care is very important to us, and tobacco use as well. So those exams twice a year and cleanings could literally save somebody's life. And if some of your clients were to ask about oral cancer, then obviously we've got some great cancer products here at Messer Financial as well that would be a good fit for them there. And as a reminder, what's so important about these preventive checkups is they find out so many other things about the human body through the prevention and care of the mouth and the tissues in the mouth, and how they are in terms of healthiness. So don't be afraid to talk about some of that stuff, and use Brian's website as a reference to what some of that care would be if we don't catch it early on. If you have questions about the product, or you need to get some of those additional handouts or help with the website once you're contracted, again, the number here is 866-568-9649, and ask to speak to someone in producer support or one of the marketing directors like myself. I want to again thank Brian for his time, and Emeritus for putting together some great products for us, and we look forward to seeing what they have for us in the future. Very easy to contract, guys. Use your Sure LC profile if you don't have one. Again, call us. We'll help you get that set up and get you out there selling a great dental product in a very short period of time. Brian, thanks again. Guys, thank you. Hopefully you're warm and safe wherever you are out there. Let's have a great remainder of the week, and happy selling to you. Have a great Wednesday, and thanks again for attending a Messer Webinar Wednesday. Thanks, Brian.
Thank you.